Hello, my name is Michael Munyon, and it's my pleasure to welcome you to this session entitled A Couple's Approach to Addiction Recovery. Our speakers for today's session are Doctors John and Julie Gottman and Robert Navarra.
Hi, my name is John Gottman. For many years, despite the groundbreaking research of Timothy O'Farrell and Barbara McCready, who used the couples approach to alcohol addiction, a couples approach to addiction was denigrated as fostering codependency rather than interdependency. It is my great honor to introduce you to Dr. Robert Navarra, who will discuss a couples-based approach to recovery from addiction.
We have known Dr. Navarra for about 15 years, maybe 20 years. I don't want to think about how old I am. And Dr. Navarra has been one of the most outstanding therapists that we have ever worked with. And prior to our meeting him, he had worked with addiction for many, many years. I consider him the most qualified, brilliant, innovative, and creative thinker about treating addiction in couples therapy today. So now we will turn over the rest of the presentation to Dr. Navarra for your enlightenment and enjoyment. Thank you.
I want to thank you for joining us during this time in which we're going to be talking about a relational approach to addiction recovery. And when I do trainings for therapists in an approach to help a relational approach, I sometimes introduce the workshop as Recovery Anarchy 101, because the prevailing model now is to pretty much ignore or postpone a relational approach in addiction recovery. And it turns out from the research that is something we don't need to be doing. And in fact, there's great evidence that supports the notion of a relational approach to recovery that sustains a person's recovery and can integrate recovery into the relationship. So these are the common beliefs, I believe, that we often see in treatment programs and with treatment professionals. And intuitively, they probably make a lot of sense to most people. So addiction is a family disease. Now, the concept of addiction and disease sometimes raises controversy. And it's important to understand that there's a difference, and this is research-based things I'm putting together right now. There's a difference between problematic use of a substance or problematic behavior, and then a use disorder, which would meet the DSM-5 criteria, meeting at least 2 of the symptoms of an addictive disorder, and addiction. Now that may come as a surprise because almost always the DSM definitions of a substance use disorder or an addictive disorder is associated with addiction. And what we know is the research indicates that people diagnosed with alcohol use disorder, for instance, now will not meet that criteria in 4 years. You go, well, wow, why is that? Because what we have is a symptom-based definition of a use disorder. When it moves into addiction, then what we're looking at are structural and fundamental changes that take place in the brain that define it as a disease. So is addiction a disease? Yes, it meets all the criteria for that. The evidence cannot be disputed. We know where addiction takes place in the brain. We know the phases of addiction. We know that there's actually neuronal changes that take place in the structure of the neuron, literally, and also that there's changes in the neurotransmitter system and the reward system and the links between the midbrain and the frontal cortex. So we know these avenues of addictive disorder progression. Is addiction a disease? Yes. All right, so that's a bit of a blurb on just the disease part. Most people who have an issue or a problem with substance use don't meet the criteria for an addiction. So I just want to put out now that it doesn't mean treatment. It means that it's just not an addiction. It just requires a different intervention. What this workshop is about is dealing with the consequences of an addiction. And almost oversimply stated would be the concept of an addictive disorder at the severe end. So when we've got 11 symptoms on the DSM-5, and if you meet 2 of them, then you qualify for an addictive disorder mild. And then when we get up to 4, it's moderate. At 6, we have severe. What I'm talking about are people at the severe end of an addictive disorder that most likely have the actual disease of addiction. Long preamble to say that when there's addiction in the family, it hits each individual and affects everyone. So is addiction a family disease? It's not a controversial statement for most people. So yeah, it's a family disease in that it affects everyone.
Dr. Navarra, thank you so much for an engaging and informative presentation. We're joined now by Drs. John and Julie Gottman, who are going to be here with Dr. Navarra for the Q&A. We have many questions that have been submitted, and we want to get to as many as possible, so thank you. The next question is, how would you work with couples that meet and begin their relationship during early recovery within the first year?
Yeah, okay. So if they're in early recovery and they meet in that first year, traditional wisdom is that's usually not a great time to start a new relationship. So it isn't and I agree it's not the best idea, right? So I think that presents special challenges because there's so much going on. So, if they're already in the relationship, I guess I probably would emphasize the challenges and the traditional kind of responses that many addiction treatment professionals would give to say this is, pretty risky. So you'd want to help. You'd have to do a really good assessment. And Gottman trained therapists, by the way, do a really good assessment. And John and Julie's work, hey, John and Julie, on how to assess and provide a very detailed assessment is where I would go with this initially. Beyond that, I think what the controversy once again is that couples that have been together for a while may have met in recovery, but they're in recovery. So that's one dynamic that presents a certain scenario. I had a couple that had 17 years of continuous recovery, 17 years. He was her drug dealer. That's how they met. There's a concept called oral history. Like, how did you meet as a couple? And she looked at him and with fondness and admiration said, oh, he was my drug dealer and he didn't turn me in when the police tried to get his list. And that was a love moment that they shared. The point is, 17 years later, I have all these relationship issues. And they had never talked about the impact of addiction on their relationship back then. There were serial affairs and there was crime involved and a lot of betrayals. So the idea is, let's talk about the thing that happened 17 years ago that you've never really addressed. And that's what needed to happen. There was an example, they came in with a conflict where he said, we had this huge fight. They had 2 cars and they were going to drive home. So he asked her, and that was it, which way are you going to go? There's different options. So she told him the way she was going to go. And then she goes home another way. The next session, they had this huge fight. A really heated argument. And he goes, well, she didn't follow through on what she said. And what that related to was trauma that had never been talked about because all the serial lies, I should say, really emerged, and that amygdala hippocampus were activated 17 years post all the lies and betrayals. So there's a way to educate therapists to say, if your couple's been in recovery for a while, don't assume that they've worked through everything. I would always say, let's talk about have you ever talked about the impact of addiction? When did you meet? When did you get in recovery? So all of this is part of an initial couple assessment that helps you figure out what the next steps are.
Bob, can I add something?
Absolutely.
So first of all, you have talked earlier about impulse control, how the prefrontal cortex is offline. Well, I really do think that frequently the couples who end up meeting in recovery and then joining each other still are operating under that lack of impulse control. And they are trying to run from the pain beneath the need to numb themselves with a substance or certain type of behavior. So it's often an attachment injury that they are attempting to address by reattaching to somebody else within the program, and without forethought, without really considering the impact of that relationship and where they're at in terms of their judgment. So one of the things, if the relationship has already begun and they are determined to follow through with the relationship, I try to coach people to slow it down, to give a chance for their, as you put it, Bob, so brilliantly, to get their prefrontal cortex back online as they slowly but surely detox. And that takes months, as we know, not just days. And to meet, if they really must meet, perhaps meet once a week. And that is all. And it's very, very difficult for people to honor that. But in the meantime, in the therapy, what I think is really helpful to address are the earlier attachment injuries that are creating this horrible empty cavern inside each individual, particularly perhaps the person who initiated the connection between the couple, and address the pain and the trauma of that early abandonment, early injury that, again, they're using a relationship to run away from.
Mm-hmm.
That can help slow it down too.
Mm-hmm. Mm-hmm. It's a great point.
Excellent. And I think the timing on that was beautiful, Dr. Navarra. Your presentation has been excellent and outstanding, and the support and relationship that you've got with both Dr. John and Julie Gottman. It's fabulous to see that. So on behalf of our attendees, I want to thank all three of you for your work with us in this arena and for your presentation today.
Thank you, Michael.
Thank you for your help, Michael. Thank you.
Thank you.
Hi, this is Dr. Navarra. I hope you found this video useful, so please hit the thumbs up button and pass the word. If you would like to receive the latest notifications of relationship tips, hit the subscribe button. Thanks.